Welcome to Mental Health Mini number 37 on phobias. A phobia is a fear of a specific object or situation that induces severe anxiety or panic and is out of proportion to the trigger. This severe anxiety causes avoidant behaviors. Social phobia is the most common phobia, and we'll break down a couple of different phobias. And phobias generally develop in the individual's 20s and 30s, and it can be very long lasting. While that's most commonly when it does develop, we can see it in childhood as well. And phobias are more commonly experienced by women than men. Common types of phobias would be agoraphobia, which is the fear of public spaces without the ability to escape if something happens. So, someone with agoraphobia often confines to their home. Social anxiety disorder or social phobias is the fear of doing something embarrassing or being judged in a public setting. So they often avoid public speaking, eating in front of others. They oftentimes will choose not to go on dates because they're worried about the judgment they may receive. Misophobia is the fear of dirt, germs, and contamination. Claustrophobia is the fear of closed spaces. Balanophobia is the fear of needles. Arachnophobia is the fear of spiders. Aquaphobia is the fear of water. And acrophobia is the fear of heights. When looking at the development of phobias, we're not entirely sure how they happen, but the psychoanalytic theory believes that phobias are an expression of unconscious fears. The learning theory states that it's classically conditioned to fear, or that we develop the fear through modeling behaviors. So, for example, if someone has a severe phobia to snakes, they may have developed that because their parents have encouraged them to fear snakes or avoid snakes, or maybe one of their parents has a phobia of snakes as well. Cognitive theories state that it develops from negative and irrational thinking that can develop into a phobia, um, and that we can also develop phobias by feeling a lack of control. The last theory is that brain functioning occurs dysfunction in the prefrontal cortex and the amygdala. Treatment for phobias would be exposure therapy or implosion therapy. And this is when we flood the individual with either similarities to their phobia or their actual phobia to the point that they become desensitized to it. So, using the snake example again, exposure therapy would be having the patient look at pictures of snakes, then maybe looking at toys of snakes, and then maybe being exposed to a real snake so that each time they're exposed, they experience a less severe reaction to it. We can also use systematic desensitization. If someone has social phobia, they can go to Toastmasters Club where they would alternate leading the group and practicing their social speaking skills and social skills so that they don't have as much anxiety when they do engage in social interactions. We can do cognitive behavioral therapy, support groups, provide them with an SSRI or an SNRI, or benzodiazepines. Our main nursing problems would be impaired social interactions, impaired ability to function at work or school, and avoidant behaviors. Our evaluation of effectiveness of treatment would be decreased reaction to that phobia, improved social interactions, improved functioning, and cessation of avoidant behaviors. And that wraps up our medication or our psychiatric mini on phobias.